A new $27 million facility here by global firm Hilleman Laboratories will produce vaccines for Singapore's use in any future pandemic. The plant is the first of its kind in the city-state that can develop a vaccine from start to finish. Shelin Sia has more.
6 million doses of vaccines each year. That's how much the new Hilleman Laboratories facility can produce. While it's now focused on developing vaccines on clinical trial, it can also pivot to mass manufacture shots in an outbreak. This is an area it's strengthened since COVID-19.
During the COVID pandemic, there was a lot of requirements for localization of vaccine manufacturing. So our commitment locally for Singapore is that in the event there is a global health emergency, we'll be able to use the ACES facility to make vaccines made available locally.
Health Minister Ong Ye Kung says the facility plays a key role in Singapore's pandemic preparedness. He notes that many countries are looking at building up capacity to develop and manufacture vaccines. This is so that they are self-sufficient during a pandemic. But given Singapore's smaller market size, Mr. Ong says the nation takes a different approach, one that focuses on public-private partnerships and international cooperation.
And we are therefore anchoring key stakeholders to support end-to-end vaccine development and manufacturing. This approach turns our population's modest vaccine needs into a strength. Partnering with private sector vaccine manufacturers allows for a win-win situation where Singaporeans have speedy access to pandemic vaccines, while vaccine manufacturers will produce for the region and the world from Singapore to meet their demands.
Meanwhile, in peacetime, Hilleman Laboratories will focus on developing vaccines for common diseases in the region and beyond. This includes the Lassa and chikungunya viruses, as well as meningitis and cholera. The facility is also exploring new technology which could ease the transport of these vaccines.
The lab also uses a live viral vector platform to develop thermostable vaccines for viruses like Ebola. And that's where the live virus has been modified to deliver protection. And the method means that these vaccines can withstand even strong heat conditions.